So the title of the first lecture is a bit strange. Mother tongue languages and mother tongue moralities. What the heck is that? On the culturality and contextuality of ethics and moral. And it relates exactly to the fact that participants from so many different countries and culture are present in this course. Let's start with this question posed by Peter Singer and his wife in this beautiful book, The Moral of the Story. I quote, "From the age at which we are capable of thinking for ourselves, we make choices that shape the kind of person we will become, or perhaps we fail to choose and allow ourselves to be pushed in the direction that our parents, our teachers, or our peers want us to go. Then for the rest of our lives, we have to deal with the consequences. In some cases, we follow a path laid down in adolescence and never again reflect on our direction. In others, perhaps prompted by an unexpected crisis, we pause and reconsider our life. The question, who am I, is fundamentally an ethical question, one that raises deep issues about what it is to be moral, how we can develop the kind of self that makes ethical choices, and in accordance with what values we will choose to live." End of quote. My professor in philosophy, the late Knut Erik Tranøy, had a fascination for language metaphors and analogies. And my suspicion is that this was caused by his encounter with Ludwig Wittgenstein, the philosophical giant he befriended while doing his PhD at the University of Cambridge, but whose philosophy he came to know only several years after the death of this enigmatic personality. In one, Wittgenstein, he wrote a lot of aphorisms. And one of his aphorisms relates to this. He said, "Whereof one cannot speak, thereof one must be silent." And by this phrase, he tried to emphasize the limit of language in the face of human understanding and action. So what kind of moral language should we strive to make use of? Tranøy turned his attention to the language of morality, and notably with a focus on the relation between our mother tongue language and the kind of morality each of us makes use of in our everyday lives. That brings me to two observations. First, we have participants from a lot of different countries and cultures in this course. This means that a lot of different mother tongue languages are represented here. From Latin America, from the Caribbean, from Europe, from Australia, from Africa, from Asia. This implies that although we are going to dialogue together in English, each of us will, in addition, be using our proper mother tongue language and grammar when reflecting on moral issues. Why do I say this? Let me try to explain. We all know that we possess a mother tongue language. But my claim is that none of us remember when or how we learned that language. And that brings me back to the relation between what I call our mother tongue languages and the language of morality. And to illustrate this, I will make use of an example Trane used to use. That is one of the situations he often turned to in order to explain his fascination with regard to the relation between language and morality, was a situation where children are playing. Suddenly one of them starts crying, and as an adult, you try to intervene to establish some kind of order. And you can be pretty sure that the response from at least one of the other children is in the form of a moral disclaimer. It was not my fault, or I am not to blame. So children start using moral language, moral concept very early in their life. Where does it come from? Another situation illustrating the same is distribution of sweets among a group of children. If you happen to give some of them a bit more, the immediate response from the others will be with reference to morality. This is not fair, or it is unfair. In other words, children start using moral concepts quite early in life, and their use seems to be quite to the point as well. Where does it come from? How is our capacity to make moral judgments generated? Trane was inspired by Noam Chomsky's theory of a universal grammar and Chomsky's idea that just as our language capabilities are partly innate, so is our capacity as human beings for moral judgment. However, what moral judgment is and what its basis may be, says Chomsky, we do not know for sure. And then he continues, but we can hardly doubt that it is rooted in fundamental human nature. It cannot be merely a matter of convention that we find some things to be right, others wrong. Growing up in a particular society, a child acquires standards and principles of moral judgment. These are acquired on the basis of limited evidence, but they have broad and often quite precise applicability. End of quote. Or, and we are going to continue this long quote because it is so important. The acquisition of a specific moral and ethical system, wide-ranging and often precise in its consequences, cannot simply be the result of shaping and control by the social environment. As in the case of language, the environment is far too impoverished and indeterminate to provide this system to the child in its full richness and applicability. Knowing little about the matter, we're compelled to speculate, but it certainly seems reasonable to speculate that the moral and ethical system acquired by the child owes much to some innate human faculty. The environment is relevant, as in the case of language, vision, and so on. Thus, we can find individual and cultural divergence, but there is surely a common basis rooted in our nature. End of quote. Trane never tried to prove his theory about the family resemblance between our mother tongue language and our morality, but he was convinced about two things with regard to this relation. First, that children start learning their morality in the same period of time they learn to speak and acquire their mother tongue language. And second, this mother tongue morality is what constitutes the basis for our capacity for moral judgment. This is for me extremely important to keep in mind. The kind of morality that characterizes each of us as moral beings is rooted in a time period that probably is exactly the same time period when we learned our mother tongue languages. So all of us are carriers of two kinds of languages, a mother tongue language and a mother tongue morality. And when we engage with each other in the forum of deliberation, we will engage as individuals with our cultural backgrounds, with our different mother tongue languages, trying to dialogue in English. Some of you are excellent in speaking English, others are striving to speak in English. But we will also engage with each other with our mother tongue moralities. And it might be that some of the challenges raised by this course will be challenges related to this deep-seated kind of morality that characterizes each of us. So, is there a universal moral grammar, to continue using this language metaphor? Here's a quote from John Michael. Evidence, although not conclusive, for the existence of a universal moral grammar comes from studies in psychology, linguistics, anthropology, as well as cognitive neuroscience. And these studies support, and I quote, the hypothesis that humans possess an innate moral faculty that is analogous in some respects to the language faculty that has been postulated by Chomsky and other linguists. End of quote. That brings me then to the question, when does moral learning take place? Most people, Trana used to say, learn their morality without ever having met a moral philosopher or attended an ethics course. Even philosophers, he went on, when they are not writing scholarly papers scrutinizing each other's philosophical positions, when they leave their offices to go home, they do not behave and act in compliance with their theoretical beliefs. On the contrary, they live their mother tongue morality. That is, the kind of morality each of them learned at the time in their lives when they began to acquire their mother tongue language. This analogy between mother tongue language and the kind of morality that defines each of us as moral agents represents the didactic point of departure of this lecture. What I mean by this is that moral learning represents a kind of learning that I believe should engage not only our cognitive capacities and aspirations, that our mind, but also our hearts and intuitions. As poetically stated by Martha Nussbaum, arguments must be of such a kind as to change the heart. So persuasion in moral matters is a much more complex thing than, for example, persuasion in logic or mathematics. And to continue on that, in mathematics, 2 + 2 is always 4. 5 - 3 is always 2, everywhere in the world, at any time. But in ethics, 2 + 2 is 4 only in very rare situations. Very often it can be 5, 7, 3. Why do I say this? I say this to emphasize that persuasion in moral matters requires something more than logical consistency. Persuasion in moral matters requires a much thicker logic, so to speak. I often use an example. John Harris is an outstanding utilitarian philosopher and ethicist. He has published a lot of books and articles. It's very difficult to find logical flaws in his argumentation. But it is also a fact that when it comes to taking a stance on moral matters, John Harris has a tendency to end up in an extreme minority position because people are not persuaded by his arguments, although his arguments are logically consistent. Because a lot of people find that his moral stance does not relate to my own moral intuitions, does not comply with my moral intuitions. So to illustrate this and what it entails in terms of ethics teaching, consider first the question, what should we aim at when teaching medical ethics to students? Here are some tentative answers. To raise moral awareness, to foster moral reflection and self-reflection, to increase moral knowledge and understanding, to promote moral dialogue and deliberation, to enhance moral sensitivity, and finally to develop moral skills. Yes, all these objectives, teaching objectives, are important. But I would add 4 in addition. Ethics teaching, I have come to believe, should aim at something beyond these noble aspirations. And metaphorically speaking, what ethics teaching should strive at achieving, in addition, is to generate some sort of movement, to produce some sort of purification. The ancient Greeks used the word catharsis, which means some kind of purification, to foster therapeutic doubt, and to reduce moral blindness. What are the consequences of this understanding for moral learning? First, moral learning is deeply personal. It starts as an inner dialogue between yourself and your mother tongue morality. Moral learning is a contextual thing. It takes place in the ambiences and cultures where you live and work. Moral learning is a social thing, and it is fostered through genuine dialogue with others. And that is the reason why in this course, so much emphasis is put on the forum of deliberation. The lectures are important, but the most important part of this course is what will be going on in the forum of deliberation, where questions will be posed by us, and where we want you to engage with these questions, and starting not with what you think you should answer with reference to literature you have read already, but starting with how would you, with reference to your own mother tongue morality, answer these questions. And then you should also engage with the answers from the others. And then we as facilitators, we will engage with you in, hopefully, a genuine dialogue. Because that is what moral learning is about. It is to engage first with yourself in an inner dialogue where you reflect on, okay, what is right for me? What is the right answer for me? If I think about or make use of my own moral intuitions, you should not think first what is expected that I should answer. You should think first, what would be my answer based on my personal moral views, based on my mother tongue morality. And then the fourth consequence is that moral learning is a kind of Socratic learning. Socrates is considered the founding father of Western philosophy. He never wrote anything. We know about Socrates' philosophy thanks to, first and foremost, his most famous student, namely Plato. Plato, as a philosopher, wrote dialogues, and in most of the dialogues, Socrates played a crucial role. We know Socrates and his philosophy because of another giant in that period, namely Isocrates, who was also a philosopher. And third, we know about his philosophy through a comic playwright, Aristophanes, who is considered the founding father of comic theater. In his dialogues, Plato makes use of two analogies or metaphors to put emphasis on what moral teaching and learning is about. And the first analogy you find in a dialogue named Theaetetus. And I quote, "My art of midwifery is in general like theirs, that is, the midwives. The only difference is that my patients are men, not women, and my concern is not with the body, but with the soul that is in travail of birth. And the highest point of my art is the power to prove by every test whether the offspring of a young man's thought is a false phantom or instinct with life and truth." What are the consequences of thinking about moral teaching and moral learning in this way? First, moral learning is a vulnerable and risky thing, filled with expectations and hope, but also with distress and pain, as is the case for a pregnant woman. Second, as the midwife's task is not to give birth to a child of their own, but to use their art to assist and advise women in the delivery, the facilitator's role is to be a helpful knower in relations to the students' attempts at coming to terms with their own moral beliefs, convictions, and doubts. And that's the reason we call ourselves facilitators, not teachers. We look upon our roles in this course as some kind of midwife, where we engage with you. You have applied for this course, and among almost 500 who applied for this course, you are the lucky ones. But it is important to take into account that attending this course might be also felt by you as risky, because in this course, some of you will feel that your mother tongue moralities will be challenged. Third, as the midwives, and I quote again from the Theaetetus dialogue, with the drugs and incantations they administer can make a difficult labor easy, it is within the facilitator's power and responsibility to deal in an artful way with the pain and distress arising from the process of learning through dialogue. And one sort of stress that you may experience during this course is that you will struggle with the technical aspects of attending this e-learning course. If you have questions about that, then you should ask those questions in the forum of consultation. But all the things that stresses you with regard to topics we discuss that challenge your mother tongue morality, these questions and these things you should engage with us and the others in the forum of deliberation. So again, to repeat, the core of this course is the forum of deliberation. It is here that the majority of the learning we hope that you will experience during this course. It is within the context of the forum of deliberation and what is going on there that you will learn the most. So we plead to you, please be active in the forum of deliberation. The second analogy Plato makes use of to explain what moral teaching and learning is about, he compares the relation between the facilitator and the student with the physician-patient relation. And I will first read this quote from another dialogue entitled "The Sophist." For as the physician considers that the body will receive no benefit from taking food until the internal obstacles have been removed, so the purifier of the soul is conscious that his patient will receive no benefit from the application of knowledge until he is refuted, and from refutation learns modesty. He must be purged of his prejudices first and made to think that he knows only what he knows and no more. So how should we interpret this fascinating quote? And how should we understand this analogy between the physician-patient and the relation between the facilitator and the participant in an ethics course? First, this does not mean, when Plato is using this analogy, it does not mean that the student is the patient. It does not mean that the ethics teacher is the physician, is like the physician. The only true physician in this relation is the moral dialogue going on between teacher and student. That is also the reason we consider the forum of deliberation so important, because it is through dialogue that we, you as participants and we as facilitators, we can learn. So in a way, we are, analogically speaking, all patients in need of moral therapy. And the true doctor is the dialogue. It is not we as facilitators who are the doctors and you as participants who are the patients. No. The only true doctor in this relation is the dialogue. And the dialogue will take place in the forum of deliberation. According to Plato, there is, however, one difference between the ethics teacher and the student, in the sense that the ethics teacher might function as a drug, as a pharmakon, that is the ancient Greek word for a drug, in the student's attempt at coming to terms with his own morality. So do you see here how these two analogies from Plato's dialogues align very well with what I started with at the beginning of this lecture, the relation between our mother tongue languages and our mother tongue moralities. That brings me to the final observation in this lecture. The main didactic implication of viewing the relation between the ethics teacher, facilitator, and his students in this way is that lectures should not play the main role in ethics teaching, that the role should instead be given to the forum of deliberation, as is the case in this training. Because everybody, also we as facilitators, when we participate in such a course as facilitators, or you as participants, we should all acknowledge that we might learn something from this course if we engage in an open-minded way with all the participants in the forum of deliberation, in genuine dialogue. And to clarify this a bit more, I studied mathematics for 2 years. In the mathematics class, there was not a horizontal relation between the math professors and our students. It was an asymmetric relation, because the math professor, he knew much more about how to resolve the mathematical equations he or she presented to us. And that makes also the didactic challenge in teaching mathematics different from teaching ethics. Because when you teach ethics, you teach somebody about something where the participants are as morally competent to make moral decisions as the ethics teachers. I'm a professor in medical ethics. I have worked as a professor in medical ethics for almost 30 years. I know much more about the history of ethics, ethical principles, different ethical theories, the grammar of ethics, much more than my students, and probably more than most of you. But I am not more able to make moral decisions than any one of you or any one of my students. And if that is the case, that means also that teaching ethics and learning ethics is completely different from teaching mathematics or learning mathematics. We are all in need of moral learning through our whole of our lives. And we can learn as Socrates. I said Socrates never wrote anything. What Socrates did every day, he went down to the ancient marketplace in Athens, talking with people about what is justice, what is courage, what is health, what is temperance, what is goodness. He talked with carpenters, with physicians, with slaves, with women, all kinds of people. And he insisted that he learned from all these different individuals with their background. He learned the essence of ethics. So, if we engage with each other genuinely in the forum of the deliberation, in dialogue, not to show how clever we are, but to show ourselves as moral agents with our backgrounds, with our different mother tongue languages, and with our different mother tongue moralities. If we do that, then this course will be a success. And that was the end of my lecture.